The body keeps the score. Brain, mind, and body in the healing of trauma explores how trauma reshapes the brain and body, as well as the pathways to healing. Dr. Bessel van der Kolk, a leading trauma expert, combines neuroscience, clinical insights, and patient stories to explain how traumatic experiences leave lasting imprints on both the mind and body. Core concepts from the book. 1. The biology of trauma. Trauma changes how the brain functions, particularly in the limbic system. The amygdala becomes hyperactive, causing fear and hypervigilance. The prefrontal cortex struggles to regulate emotions, and the hippocampus has difficulty distinguishing past trauma from the present, leading to flashbacks and intrusive memories. This creates a state where survivors feel stuck in survival mode. 2. Trauma lives in the body. Beyond mental and emotional symptoms, trauma survivors often carry physical manifestations of their experiences. Chronic pain, tension, fatigue, and autoimmune conditions are common because the body remains in a state of heightened stress, even when the danger has passed. Van der Kolk describes this as the body's memory of trauma. 3. The role of relationships. Healthy relationships play a critical role in developing emotional regulation and a sense of safety. However, trauma, especially from abusive or neglectful relationships, disrupts this process, causing survivors to feel disconnected and mistrustful of others. Healing begins with rebuilding safety in relationships, whether through therapy or supportive communities. 4. Limitations of talk therapy and medication. While traditional treatments like talk therapy and medications can help manage symptoms, they often fail to address the body's role in trauma. Trauma is not only stored in memories but also in physical sensations and reactions, which need to be directly addressed for true recovery. 5. Effective healing modalities. The book highlights body-centered therapies that directly engage the nervous system and help release trauma stored in the body. Key methods discussed include: yoga helps survivors reconnect with their bodies, calm their minds, and regain a sense of control. Eye movement desensitization and reprocessing, EMDR, assists the brain in reprocessing traumatic memories and reducing their emotional intensity. Mindfulness practices enable survivors to stay grounded in the present, reducing the grip of past trauma. Neurofeedback uses brainwave training to improve self-regulation and emotional control. Creative therapies, theater and art, provide nonverbal ways to express and process trauma. 6. Healing and recovery. Recovery involves reconnecting with the body, calming the mind, and processing trauma in a safe and supportive environment. Van der Kolk emphasizes that healing is not just about managing symptoms but about reclaiming a sense of agency and wholeness. Survivors can learn to feel safe in their bodies again and re-establish healthy relationships with themselves and others. Conclusion. The central message of The Body Keeps the Score is that trauma fundamentally changes how people experience themselves and the world, but recovery is possible through approaches that integrate the mind and body. By addressing the deep physical and emotional scars left by trauma, individuals can regain their sense of control, trust, and connection.